Hello, I'm Annette Sherman, and I would like to talk to you about fibromyalgia. In 2005, I was experiencing pain all over, but it was not always in the same spot every day. I spoke to my physician, and after x-rays and MRIs were done, she told me there was nothing wrong with me, that it was all in my head. I knew what I was feeling. I knew it wasn't all in my head. I knew I was in excruciating pain. There were days I couldn't get out of bed. In 2006, after finding a new physician, I was diagnosed with fibromyalgia and thought finally someone can explain to me what is happening. Well, at least why I was in so much pain. The rest of it, I'm still waiting to find out. Might be the husband and 3 kids. Anyway, over the years, more and more doctors have recognized fibromyalgia as a real disease, although it is sometimes hard to diagnose because there are no diagnostic tests such as x-rays or blood tests. Tests can be done to rule out other health problems, but according to the American College of Rheumatology, doctors diagnose fibromyalgia based on all the patient's relevant symptoms. Fibromyalgia causes widespread pain and tenderness, making you sensitive to touch. The pain and tenderness tend to come and go and move about the body. Some of the symptoms most often associated with fibromyalgia are tenderness to touch or pressure affecting joints and muscles, fatigue, sleep problems, problems with memory or thinking clearly. Some patients may also have depression or anxiety, migraine or tension headaches, digestive problems such as IBS or GERD, irritable or overactive bladder, pelvic pain, and TMJ. Symptoms of fibromyalgia and its related problems can vary in intensity. Stress often worsens the symptoms, and I can tell you from experience that this is true. The weather affects how you feel. How much you do the day before affects how you feel. Everything affects your fibromyalgia. Fibromyalgia is a real disease that affects 2 to 4% of people, mostly women, although men can be affected by it. It most often starts in middle adulthood, but can occur in the teen years and in old age. There's no cure for it, but with medications and proper self-care, there is some relief from the symptoms. I was put on Lyrica, and over the years I've gone from 50 milligrams once a day to 200 milligrams 3 times a day to try and ease some of my symptoms. I'm also on meloxicam, which is another drug that's sometimes given. They don't take the pain away. They do help to ease it a little bit, depending on how severe your symptoms are or how you're feeling that day. Unlike other diseases, you cannot tell by looking at someone that they have fibromyalgia. I have told people that I suffer from this. They look at me and say, well, it does not look like you're in any pain. Although most days I have a hard time getting out of bed, washing my dishes, or doing homework. Some of the littlest things I cannot do. Fibromyalgia is real, and just because you cannot see how much pain its sufferers are in, do not be quick to say it's all in their heads. They have just learned how to deal with it most days because that is all they can do. They're not lazy. They just have problems sleeping or feeling refreshed when they wake up. They're not weak. They're just tender to touch or pressure. So please, do not tell them it's all in their head, because it's really not in our head. It's in our body and it hurts.